Okay, well, good afternoon, everybody. We'll call to order our June 25th meeting of the Board of Health. Looks like we've got Commissioner Jordan and Maureen Rosette online, and absent from the room so far is Dr. Monica Blakowski-May and Commissioner Waldriff. And we do expect Dr. Blakowski-May will join virtually. Okay. So with that, we'll go to citizen input. Is there anybody signed up to speak?
There's no one signed up.
No one signed up. Presuming everybody here, nobody here is here to speak. So with that, we'll move on to board reports, chair reports. I guess we'll talk more about the facility stuff, but that's probably the main substantive issue to update folks on. But we had a great tour looking at the building here about 2 weeks ago, and explored the roof and some different nooks and crannies underneath the building as well, and got to see kind of how it all works together. But I thought that was a very interesting experience to have, and we had a few staff people that went with us, as well as Travis, our facilities director, and was able to, I think, call out some good plans for some capital projects that we'll talk about here a little bit later. But other than that, I don't really have a whole lot else to firmly update us on. So we'll go to committee reports. And I don't know, Commissioner Brooks?
I was not able to attend the Budget and Finance Committee meeting, so I'm going to see if Patricia, if you want to give, sorry to put you on the spot, give a little quick brief update.
We had the Finance Committee meeting on June 18th, if that sounds right. Basically, everything was pretty standard. Still talking a little bit about the food vendors and potentially increasing fees for violations of that. And then we have some things going on with the auditor, and that's about it. Plus, we added in the Facilities Committee discussion to that.
Yeah, we have the state auditor entrance interview here coming up next week, I think it is. And then, Patricia, do you want to just finish off kind of where I left off on the facilities with just a few other the details from our meeting?
Yeah, I was going to ask. I did make minutes from that, but I don't know if we should be doing that, or I haven't quite figured out whether we're going to have minutes from those meetings or not. But I did make them, so if anybody wants them, I have them.
Maybe you can just submit those
Madison
to Ann, and
has
then
them.
we can.
Yeah, I gave them to
Great.
her, so if anyone wants. Travis gave us an overview of the facilities planning and his intentions to do a 20 to 30-year plan. That was great. We toured the building. We talked about the fire doors and the need to replace the fire doors. And we also discussed other capital priorities and the roof. And we toured the roof, and that was really interesting up there. There's some damage that's occurring, and we're trying to take care of that. So I think that's in our next discussion to try to approve those items.
Good, and we didn't have a committee meeting for policy and education, so we can move along then to our consent agenda. And if someone would like to make a motion to approve the consent agenda as written.
I'll second.
Got a motion and a second to approve the consent agenda. Any discussion? Hearing none. All in favor, say aye.
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 Any opposed? Abstaining? Okay, that passes. And then just to confirm, Michelle, no executive session?
Correct.
Okay. So we will move into, this might be the first time we've not had an executive session, actually. Good call. Okay, so let's move into our action items then. 7A is Resolution 26-09, adoption of a labor contract for employees of SRHD who are members of the Washington State Nurses Union for the period of January 1 through December 31, 2028. January 1, 2026 through December 31, 2028. And is there any comments, presentation on this item from anybody? Danny, anything from you?
Chair.
Oh, Ray, please,
Yeah.
thank you.
I can give just a little bit of an overview on that. First of all, I'd just like to say thanks to WSNA for the work that we've done together with them. Came to a tentative agreement back in May. We were not able to bring it to the board then just because they had not ratified that yet. So they did ratify before we had a chance to do a complete scrub on that. So we do have just a couple small changes in here, but a couple things that we did want to highlight. And again, we had briefed the board on this back in April. So there's really not substantive changes from them, but the highlights that we do want to bring were really around the COLAs. So for 2026, we did agree on a 3% COLA for the nurses union as a whole. And then we also gave a market adjustment of 5% to the public health nurses. We determined that they were below market, and so we did make that adjustment to them. That's a one-time adjustment, which will be on top of the 3% COLA. And then for the 27, they agreed to a 2.5, and for 26 or 28, it was a 2.0. Most of the others, there was some cleanup of some language, clarification of some stuff, but for the most part, that's the substantive piece there. One thing that I would highlight in the resolution, the resolution speaks to a period of July 1st, 2026 through. We're going to ask that you would modify that for January 1st. When they ratified that, so there was no break in contract, and we have agreed to that. So if the board is supportive of that, we would ask that that change be made. So there's 3 different places in this resolution that we need to have that changed. And that, so just again, that's referencing that the contract will now be good January 1st of 26 through December 31st of 2028. So questions, happy to answer questions.
Questions, thoughts, comments? I'm not. If there are no questions or comments, is there a motion to approve action item 7A?
Move to approve.
Got a motion? Okay, we've got a motion and a second. Is there any discussion on the motion? Seeing none, all in favor of approving the motion to adopt Resolution 26-09, say aye. Aye. Any opposed? Any abstaining? Oh, Dr. Blakowski, I see your hand up. I apologize. Were you trying to speak to this item?
Nope, I was just raising my hand to vote.
Oh, very good. Okay, thank you very much. Okay, well, with that, 7A is adopted, so we'll move along to Resolution 26-10. And Danny, I'll turn it over to you.
First, I'd like to say, Mr. Chairman, thank you to Ray and Kim and WSNA for putting that to bed. That's when I first was talking to Ray, that was one of the things that he promised me he was going to deliver on, was to take this contract. So that was the last of his promises that he kept slightly before he retired. Resolution 26-10 is in recognition of Ray's 32 years of distinguished public service. As a little bit of a roast of him, he began here at SRHD in January of 1994 when I was playing guard at East Bank High School in West Virginia. So I've reminded him that a couple of times. But he's also served as the interim administrator a couple of times. And from my standpoint, I've seen how he kept the ship afloat and made sure that I was not given the keys to something that was on its way down. He was very conservative in a lot of things he did to make sure that this organization was in a good place, even knowing that he wasn't going to be part of it shortly thereafter. So I certainly have thanked Ray and would publicly like to thank him for helping me within the transition for the short time that we've gotten to work together. The resolution in recognition of Ray's 32 years of distinguished public service, whereas Rayburn faithfully served Spokane Regional Health District for 32 years, beginning in January 1994, as a temporary medical technologist 2 and advancing through key roles, including environmental health specialist 2, food program manager, and environmental public health division director. And whereas he provided additional leadership as interim administrator from November 2018 to May 2020, and again as co-interim administrative officer from September 2025 through May 2026, ensuring continuity during periods of organizational transition and recruitment. And whereas Ray Byrne further contributed to the broader public health community through service as a public health representative to the Spokane Clean Air Advisory Council and as a member of Feed Spokane, the National Environmental Health Association, and WSALPA's Environmental Public Health Committee. And whereas throughout his career, Ray Byrne exemplified professionalism, integrity, and dedication, strengthening public health programs, fostering collaboration, and improving community health outcomes, and building trust between Health District and the residents it serves. And whereas Ray Byrne has been a valued colleague, mentor, and respected leader, generously sharing his knowledge and expertise while fostering a spirit of collaboration and dedication among staff. And whereas his decades of service reflect not only a distinguished career, but also a lasting legacy that will continue to benefit the Health District and the community for years to come. Now, therefore, be it resolved that the Board of Health hereby expresses its deepest gratitude and sincere appreciation to Ray Byrne for 32 years of outstanding public service, many contributions, and extends its best wish to him for his continued success, health, and happiness in his future endeavors, and be it further resolved that a copy of this resolution be presented to Ray Byrne as a token of the board's respect and appreciation.
Copy of it here, and do we want to gather for a photo?
I think you can go ahead
I'm
and
gonna
vote
vote
on
on
it
it
first.
Oh, we need to
Yeah.
vote on
Yeah.
it first.
Let's-
Mr.
We got
Chair,
to adopt the actual resolution. Commissioner Jordan.
I'd like to so move approval of the item with enthusiasm, and I would appreciate the enthusiasm to be recorded in the minutes.
That's great. Well, and I think it's clear because I was ready to get out of my seat and give this to Ray. So is there a second to the motion to adopt 7B?
I will second as well as I'd like to speak to it.
Please, go ahead.
So as Ray knows, I mean, I've been here a while on the board. So through the times where he's stepped up, even though he didn't want to step up and be our interim health administrator. So I would say, you know, if Chuck were here, he'd be very happy and excited for you to retire. But Chuck Hafner was a fellow board member who spent a lot of time with Ray, I think, during the first change when he was interim. So I don't know, it's bittersweet to see you go because you're just one of those quiet leaders who really does everything you need to do and gets the job done and guides people, and truly a leader in every sense of the word. So I know you're reluctant to take on those higher level leadership roles, but you did phenomenal. So thank you, and just wish you nothing but the best in retirement.
Comments? Seeing none, we'll go to the vote. All of those in favor of adopting the motion to accept Resolution 26-10, say aye.
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 Any opposed, abstaining? That carries. Now we can present this to Ray. Do we want to gather up here for a board photo? All right.
Go ahead, I'm moving. There you go. Got it? Anybody else?
There he is.
Could not be more excited for you, Ray. If you'd like to come up, we're going to move to 7C, which is Resolution 26-11, authorizing adoption of a revised procurement of goods and services policy.
Yes, good afternoon. I'm bringing forth Resolution 26-11, authorizing an adoption of a revised procurement of goods and services policy. And if you'd like, I can read through the resolution or,
I don't know if you need to read the resolution per se,
okay,
but
but I'll
if you
do
could
the
just
highlights.
go through, yeah, that'd be
Certainly.
great.
So referring to the second page behind the resolution itself, what we're asking for a change is specifically the $50,000 threshold. We currently have in item number 2, we have 3 different levels of procurement. So between 0 up to $999 for $10,000, essentially, we get 1 quote. And then purchases between $10,000 and $49,999, we have 3 categories. We use the state DES contract, which allows us to use their bid process, and we won't have to go out and get additional quotes. We can also use cooperative group purchasing organizations, and again, not have to obtain those additional quotes. And what we're proposing in this change is to ask that in purchases and contracts over $50,000, it currently reads that we can use the Washington State contract, but we cannot use the cooperative group purchasing organizations or the MRSC small works roster, which it's currently listed under less than $50,000. So we're asking for a change to allow for those 2 purchases, or using those purchasing cooperative and MRSC small works roster alongside the state DES contract, which will help save us time in procurement. They've already done all the work as far as vetting the vendors and streamlines our process. So our policy is set by the Board of Health, which is why we're bringing it forth today and asking for that change. So we're asking, it's highlighted under the category greater than 50,000, is to include the cooperative group purchasing organizations over 50,000 to be used, as well as an MRSC small works roster. And then, of course, that will also continue. We'll do the RFQ process over 50,000 if the state contract or those 2 other methods are not available for what we're looking for.
Okay, are there questions for Kim on this item? Commissioner?
I just want to make sure, so if it's over 50,000, you will still use those 2, so say if it's 250,000, will you still use those 2 methods first? And if there's something not available, then you will go to an open bid process?
Correct, yes, yes. And that's in our policy essentially is for all purchases, we start with state contract, even on supplies and small items. We want to, that's already been vetted for us. And then up to the 50, we were doing that with the state contract, as well as the group purchasing cooperatives and MRSC small works roster. But we limited ourselves over 50 to, we excluded the cooperative and the MRSC roster. And we're finding that that's still an option for us, even over that 50, or we'd like to be able to exercise that option. If the vendor does not exist, or it's a unique project that isn't already vetted through those 3 methods, then yes, we would absolutely use the RFP process.
Okay, thank you.
Questions from anybody? If not, would entertain a motion.
So moved.
Second?
Move to adopt Resolution 26-11, and we have a second. Any further discussion? Seeing, hearing none. All in favor, say aye. Aye.
Aye.
Any opposed, nay? Abstaining. Okay, that is adopted, and that takes us right into D and E. Danny, are you presenting on this, or Travis going to speak to it?
I've got Travis here to answer the technical questions because it's going to go above my head if we get too much into it. But in your packet, you'll see that there is a piece that Travis put together with options on the roof. Our roof is in pretty good shape right now, but in a few years, it's not going to be. It's hard to tell how long it would take. We worked with the Facilities Committee and discussed this with the Finance Committee. In the packet, there's a photograph that Travis had done with a drone on our roof to get a look at what it actually looks like up there, and then the Facilities Committee got a chance to look at it up there. We know we have $115,000 left of the ARP money that has a definite date that it's going to end on. We would like to use that for the roof. And what we've put for your purview are 4 different project options that go into either the first 2 are a coat of some sort that will extend the life of the current roof, and the last 2 are full replacement options. And they're different products that have different expected life on it. So I believe that, Ms. Keenholz, your committee had a recommendation to go with the EPDM replacement, and we think that would be the wisest move as well. We know that prevailing wage will go up soon enough, and I don't think anybody believes that materials are going to go down in price anytime over the years. So what would be a new roof cost now, the contribution from SRHD for the 30-year replacement would be $435,000 and may exceed $700,000 to us if we waited 5 or 6 years. So we think it's a wise investment to do it now. It has gone through both the Finance Committee and the Facilities Committee, and I certainly would let either of the members from those 2 that want to talk to that. And if you want to ask technical questions about it, Travis can explain all the weirdo details that are way above my head.
Are there any other questions on this particular project? Yeah.
Comment, if it's, I just want to thank the Facilities Committee and the esteemed chair for the quick work on kind of getting these projects moving forward, taking a look at the building, and just getting right on top of it. So thanks for that. And I will be glad to see the ARPA dollars fully utilized on time.
Absolutely. Any other comments, questions? If not, would entertain a motion to adopt.
So moved.
Second.
Motion and a second. Any further discussion? I will just say, in our facilities meeting and as well as the budget committee meeting last week, discussing these, again, I think it makes a lot of sense. Travis gave us a lot of the good technical details, kind of backing up why it makes a lot of sense to do this. We've got another project that we'll go over here in a second as well, and both of these are timely and necessary, and we'll have some, I think, extra benefits, particularly the second one here that we're going to talk about with the fire doors, just as that's been an issue for many years. So with that, if there are no other points or comments, we will go to a vote. So all those in favor of approving, authorizing the roof replacement project, please say aye.
Aye.
Any opposed?
Aye.
Any abstaining? Okay, that one is approved. All right, we just got one left. 7E, the authorization for Spokane Regional Health District fire door replacement project.
This has been something that a lot of the employees have asked me about a great deal. If you go to the outside in the atrium, you can look up. If you're on the second and third floors, you can see that the fire doors that are meant to keep fire from spreading from the first floor and that becoming a chimney that puts it up into the second and third floor, those doors have been down for some time. I want to say a number of years. Is that correct, Travis? The fire marshal won't let us keep them open with the current design, which is from 1976. It is kind of a morale issue for the employees here. It does feel a little prisonish up there. And I know you all have talked about it in the past. We would like to go ahead and move forward with that as well. We would need to do a little more homework on it than that, but Travis has put together a pretty good estimate, and he can answer a lot of the technical questions. This one will be a little more complicated in terms of we have to make sure the fire marshal would be okay with whatever, and we would bring an engineer in to say, this is what you can do. But we want it to be open, but we also want it to be safe. The current is not safe, and it even scares employees whenever it actually operates correctly. So we would like to move forward with this and have just a little more pride in our building.
Are there any questions for Danny or Travis on this project? Tricia,
Comment,
go
just that besides not meeting the fire code, it was also mentioned that the equipment and the people who make that kind of equipment to repair it, that it's all obsolete now. So I think that is an important factor. Not only are they difficult to operate, get open, and don't fit the fire code, but they're also really difficult to repair.
Yeah, we're talking about 5,000-pound doors that no one can lift up on their own, and when they come down, apparently create quite the rumble.
24 of them.
20, and
24,
24 of
right?
them, right,
At the
exactly.
same time.
I would love to be here to experience that, just to see what that feels like. I'm sure it's quite the earthquake, but with that, if there's not any other questions for Danny, I would seek a motion.
Sure, I just have a comment.
Yeah, Derek, go ahead.
I just wanted to thank Travis and his team for taking us through the building and explaining this. This is a lot of money, and but it totally makes sense. And thank you for explaining that to us. And I think for the employees, it's going to be a huge change. So just wanted to thank you.
I think I've only ever seen the doors up once, and that was several years ago. So it'd be quite the change. Is there a motion to authorize this to move forward?
Second.
Motion and a final discussion?
Could I comment real?
Please.
I'd like to thank Travis for all the, I don't know if you all know how much of a blessing, in all the other public health agencies, I've not had an engineer that served this role. So having his technical expertise is great. And I'm also going to pick on him a little bit. Travis just had his first child the other day. So
That's right.
congratulations
Yeah.
to them.
We have to hold off on the roof.
We're going to get her done. Okay, motion and a second. Any further discussion?
Just,
Go ahead.
In the finance committee, we voted to approve both the projects. There are reserves set aside for building investments, and so I think we've looked at the finances, and it made sense too.
That's right. Okay. All of those in favor of authorizing the fire door replacement project, please say aye.
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 Any opposed, abstaining? Okay, we've got some capital projects to get done. That is all of our action items, and our agency reports are written. Is there anything for a verbal update, Dr. V, from you? Yeah, go right ahead. We'll jump to you, and then we'll move into our agency update.
So good afternoon, everyone. You do have a written report. There's just a couple of things that are more recent, just for your awareness. And before I start, I just want to say thank you to Ray for his many years of service. And I'm going to miss the riveting septic system reports that you have me review once in a while. Great reading. But a couple of things that I wanted to bring to your attention. It will take a couple minutes. We're going to talk a little bit about Ebola, West Nile, and perinatal hepatitis C, as well as a couple of activities that the team has been engaged with in the last week or so. So as you know, since May 15th or so, we've been following this evolving outbreak in the African continent, specifically in the Democratic Republic of Congo, and some cases in Uganda. There's about 1,100 cases thus far, almost 300 people dead in the DRC, and about 20 cases in Uganda and 2 deaths in that same region. The reason why I bring that up is the African continent is very big. A lot of people do fly there from the U.S., and we have established a public health screening process at the airports with the CDC and other public health officials, which is being run out of 4 different airports around the country. What it boils down to is obviously residents of the state of Washington that have traveled to any of those locations are part of this assessment that happens at the airports. And if for any reason we need to know about anyone that may have been close to any of these areas, the local jurisdiction, meaning SRHD, gets notified. And there's a process to follow. Now, the good news is we've had, since the beginning of this program, on May the 22nd, 4 adults that we have been in contact with, returning from Uganda, very low risk. They all have completed their monitoring as of the 16th. No, we don't have any current travelers, but I bring this to your attention because we may have more. The good news for us, all of them have been low risk, and there's a very low risk for the country in general anyway, so I want to emphasize that. But we are in contact with travelers if required by this program. So just so you will know what we have done thus far. Now, this past week, we actually, everybody knows about West Nile virus, most common mosquito-borne disease in the continental U.S. We did have a mosquito test positive in Benton County. There is a mosquito surveillance program that we are part of also. The mosquitoes get tested to see what species, and if it's a species that can transmit any of these viruses, then they get tested for the virus. That's how we know these things. Now, it's important to remember that because sprinklers are on, people are watering things, make sure we don't have water being deposited or contained anywhere, because that's mosquitoes like that. And we don't want to have any West Nile virus in the Spokane region. So just a reminder for appropriate water precaution around your properties as we all start to use water features and all these other wonderful things. Next thing I want to talk to you about is on June the 22nd, a couple days ago, we did send a health advisory about what has been an increase over time of perinatal hepatitis C. As you know, there is a monitoring program at a national level for all adults between 17 and 69. Hepatitis C is treatable, and if tested, people can get treated between 8 and 12 weeks and be eradicated. And unfortunately, if untreated, many patients do not have any symptoms, but can progress to severe liver disease. So it's very prevalent, not only here, but all over the world. So we want to make sure that we advise our providers about enhanced screening as we go forward. If anybody has not been tested by your provider, make sure that you've been screened as an adult at least once in your lifetime, which I'm hoping all of us have. But if you haven't, please talk to your provider about that. Now, a couple of collaborations that the team has been engaged with. Let's not forget that we have been part of the FIFA emergency response since way back when. And we still do daily awareness reports and so on and so forth. The good news, knock on wood, thank you to our partners at Gonzaga and all of the other organizations, everything is stable. We have not seen the need to engage any more than that, which is wonderful, but we'll stay engaged until this process is completed. Now, one of the things that we saw in the last week is the upriver fire. Most of us heard about it. One of the things we tend to forget about is that our Medical Reserve Corps gets alerted because of the potential need for establishing shelters for those that need to be evacuated. So they were on the alert during the various stages of the fire. I do want to say thank you to our firefighters and first responders. They did a magnificent job. I don't know how many pictures of planes dropping the retardant I've seen over the last couple of weeks, but it's totally amazing. So I just want to say thank you to them. Now, one of the things that we've been really engaged in, I've been pushing for quite some time, and I'm very happy to support, is our team going out and participating and sharing what we do. This was at the Wasalfo meeting not that long ago, and we actually had a number of people presenting. One of them was our response to Ebola and so on. Measles, which I think is being used as an example of an assertive response in the rest of the state. We also continue to write and do editorials. We edit, ghostwrite, or collaborate. So I just want to say thank you to all of the folks that participated there. And then last night we had a very interesting event. And we have the first cohort of SRHD employees to graduate from the Gonzaga Healthcare Leadership Program. 4 members of our team, you see Kira and Jean, Jessica, and Samantha from various departments. These were all folks that were selected last year in November. Thank you to Gonzaga. They gave us family and friends discount scholarships. So we were able to have this pilot group project of people to go through that program, which is wonderful. We're going to debrief the 4 students that graduated last night, and personally I think it's something that we may want to look as we go forward as a tool to continue enhancing our leadership capabilities in the organization. With that, I'm going to stop here and see if you have any questions.
Any questions for Dr. V?
And don't forget, there's a written report. This was just things that happened last week. Thank you.
I think you're off the hook. Thank you very much. And then we will go to our tobacco prevention program update.
Reports in the packet, and it's mainly online if anybody has questions.
Nothing, no presentation? All right, well, then that brings us pretty much to our end. I assume there is nobody else signed up to speak, correct? Is there anything from any board members for the good of the order, or anything any board member would like to share? Seeing none? Okay. Well, with that, then we are going to adjourn, and our next meeting is currently scheduled for July 30. So we'll see everybody back here then. All right.